Hello, everyone. So today we'll address the question that many of you have asked us around how American graduates navigate their math journey, specifically the ERAS CV, the personal statement, and the interviews. What are some of the tips and best practices that IMGs can pick up from AMGs? We'll also then discuss how IMGs can match into some of the non-traditional specialties. Typically, as you know, IMGs tend to focus on internal medicine, family medicine, pediatrics, neuro, psych, and pathology. So what does it take to match into other specialties? That's also on agenda for today. So today we have Sarthi panelists. All three of them are American graduates. They have extensive experience of reviewing the IMG profiles, conducting interviews with IMGs, and of course, working with IMGs as part of their programs. And they'll share their perspective with us. So I want to welcome Dr. Alan Sputnitsky, Dr. Chad Kogan, and Dr. Joe Kuss. Welcome, gentlemen, and thank you for joining us today.
Thanks for having us. I appreciate it.
Yeah, thanks for having us.
So let's start with some introductions, although you are on our website, but I want to give you this opportunity to introduce yourselves.
Yeah, so hi, I am Joe Kuss. I am a second-year resident, and I am doing diagnostic radiology at Loyola University Medical Center out in Chicago.
Hi, my name's Alan Stupnitsky. I'm currently a second-year PM&R resident at Washington University in St. Louis. I did my intern year in New York in the Bronx at Montefiore Medical Center.
Hi, my name's Chad Kogan. I am currently a second-year resident right now at Northwestern University doing anesthesia, and I completed a transitional year in internal medicine at Weiss Memorial, which is also in Chicago.
Thank you. So let's just dive into the agenda for today. So the first is how are the IMG profiles that you have reviewed, interviewed, different from the American profiles, the American graduate profiles, especially when it comes to, say, the CV and the personal statement. So I'll go to each one of you and get your thoughts, and then move on to maybe some improvements, some the interviews, how they do differently, or what your suggestion is. So Joe, let me go to you first. In terms of the CV and personal statement, what are the differences that stand out? What are some of the strengths you've seen, and what do you think they should be doing differently?
Yeah, so one of the strengths that I noticed with a lot of the applicants that I spoke with was a lot of them had really great research experience and a lot of really great and varied clinical experiences here, that they were able to do in the US. So I think the research experience is really important, just as far as showing programs that you're interested in more than just learning to be a resident. You want to kind of get involved in activities that are going to expand your practice and help kind of further the field of medicine, which I think is something that programs like to see. And then as far as having just varied work experiences, and coming from wherever a lot of these applicants are, it's different practicing medicine here in a lot of cases than it is where they're from. And so getting a lot of good varied clinical experiences, I think, is important and is something that could really help them in the application process. Yeah, as far as the personal statements, that varies so much from person to person that there wasn't really any one trend that I noticed that stuck out that I would say is any different from like an American graduate. I noticed a lot of people talking about kind of what drove them to go into medicine, what that first sentinel event was that sparked their interest, and how that has evolved and shaped their decision over time. Something that I noticed that was common amongst a lot of the personal statements I looked at was these applicants talked about what an event in their life that kind of inspired their interest in medicine, and then how that has led to them deciding to pursue medical school, and just kind of the evolution of why they want to become a doctor and why they want to go into whatever specialty they decided to go into, which I think is good to show that they've had this, desire for a long time, that it's something they're really committed to, and, just to show residency programs that they're in this, this is really something that's important to them.
Okay.
Sure.
Thank you. Alan, what are your thoughts on the CV and the personal statement?
Yeah, so I think one of the differences that really sticks out between the IMGs and the AMG applications I've seen is just so much, like it's just a longer CV because there's so much more experience, a lot more
I see.
clinical experience, a lot more research, a lot more volunteering. I remember, looking at some of the applications of like myself and other classmates, having 3 or 4 volunteer opportunities over the time of med school, and maybe even a little bit in undergrad, compared to years of doing volunteering, doing research, being involved a lot more heavily in those clinical experiences. A lot of some of the people I've interviewed, they have they're already attendings, they've already done a residency in another country, so they have a lot more clinical experience, and that kind of translates into a personal statement a lot of times, where they can talk a lot more genuinely and deeply about patient experience. A lot of the personal statements I've seen come from like you said, a sentinel event of what made them want to go into medicine. A lot of it is often a family member is a doctor, and that kind of drove them into doing it, or they knew a family friend who was a physician, and that really was someone that they emulated, or someone that they kind of looked up to, and were motivated by that. And then all the different experiences they had, and using those patient experiences to describe what it's like to be a doctor, why they want to continue it, why they have a passion for it. So I think that's the biggest thing between the AMG and IMG applications I've seen in terms of CV personal statement changes.
Okay, thank you. Chad, anything that sticks out, anything that you noticed?
Yeah, sure. So just to piggyback off of Joe and Alan's responses, one of the main things that I noticed is just the overall length of the average IMG ERAS application is much larger than the average AMG. And I think that very much is because of what Alan astutely pointed out, which was just the amount of life experience that a lot of these IMGs and clinical experiences that they've had. It's almost double. So they have all of their home country experiences where they gain a lot of knowledge, education, and volunteer experience. And then a lot of them do all their observerships and rotations here in the States. So that being said, a lot of times I focus with my mentees and applicants and explain to them that it is important to list each and every one of these experiences, but quality sometimes over quantity is important. So if you had maybe an experience that you did once, that maybe shouldn't be a thing at the very top of your ERS application. And then also, I think it's really important that within those descriptors of all those clinical experiences, that they're well differentiated. 99% of what we do as medical volunteers or, clinical rotators, individuals going through different rotations, 90% of it is going to be very, very similar. But I think it's really important for the applicants to take that 10% that differentiates it and really highlight that. So you don't need to write, proficient in, learned EMR for each and every one, because obviously you're going to be using some type of EMR during these clinical rotations. But I've really pressed my own mentees to think of 3 or 4 novel things that were very, very different that set apart those experiences, and make sure that those are listed so that you have very quality information for each of those that allows each of those rotations to really shine, or rotations or experiences to shine and punctuate or differentiate themselves from all the other ones.
Yeah, that's a very good point, and that actually prompts me to go back to Joe and Alan. So Joe, probably starting with you, if you were to advise one change, or maybe more than one, in the CV or the personal statement, if you've seen any trend that the IMGs could change. Now, like Chad said, don't repeat stuff. Was anything that you noticed they could change or they would do differently?
So maybe a couple things that I could point to is where Chad was talking about all of these great experiences that they had. Sometimes I would see, or several times I saw maybe that they didn't provide a lot of detail, or the detail that they did provide was kind of vague as to what their role in the whatever experience, whether it was an observership or a volunteer experience, or even, you know, sometimes if they had done their internship year, it was just a little bit vague sometimes.
Mm-hmm.
And I feel like if you're going to put those experiences, kind of like Chad said, if you're going to put them on your application, you know, I feel that it's important to highlight, well, this is something, you know, that I really took an active role in, and something that was really important to me to be a part of, instead of just, well, I did this to put it on my resume, and so here it is, you know. Because I think, right, there is some value to having a quantity of things, but the more important factor, like, again, like Chad said, is having the quality of the experiences. So yeah, just describing a more specific role for each of those. And then another thing that I liked to highlight when I was talking to, you know, doing the mock interviews with the students, or with the applicants rather, was just the hobbies and interests section. Because, you know, I feel like a lot of the interviews that I went on were very conversational, where whoever I was interviewing with, you know, they would kind of look at my application and just ask me something, and, you know, it would kind of spin out from there. And, you know, we'd get to talking about, you know, whatever sort of other things. So kind of highlighting any unique interests or hobbies that they might have, I think could also be a big benefit in that aspect, where someone could say, oh, I really enjoy like climbing mountains. I've scaled, you know, the tallest peaks in South America, or wherever, you know, something unique like that would be something that I would want to talk about and ask them about. And then that person really sticks out, I think, you know, when they're discussing applicants, you say like, oh, well, did you guys talk about the guy who climbed Mount Kilimanjaro or something? That's just kind of a unique feature that makes them stick in the memory, and, you know, could help them get a spot maybe.
Okay. So Alan, before we move on to actual interviewing, anything else that you think IMGs could improve, maybe in their personal statement over and above what Chad?
Yeah, I think for the personal statement, I think sometimes we can fall into the pattern of trying to make sure we list all of our accomplishments, and, you know, trying to be as, you know, cohesive and comprehensive everything that we've done, and trying to, you know, showcase that. But I also feel that this is your chance to kind of show your voice before the interview, kind of, you know, have a reader kind of feel your personality, who you are as a person. And I think the best way to kind of have that shine is to pick a special patient or a special moment, and really dive into that story or that event, and really kind of put some introspection on it, and show, you know, what you've learned, focus on what that patient meant to you, what you'll take from that experience going forward, and really kind of highlighting, you know, gaining something like intangible versus, you know, I've done this list of accomplishments and that's why I should be picked, but really showing that, you know, you have this other side of you that is, you know, introspective, cares about patients, wants to kind of build that relationship, and, you know, kind of sticking to a main theme, I think is a little more impactful when there's you know, the readers are, you know, scrolling through dozens of these personal statements, you know, on an evening. You really want to be the one that stands out, that shows some type of story and builds your character really on a piece of paper even before the interview.
Okay. Yep. Thank you. So now let's move on to interviewing. And as you all know, you know, most of the IMGs may not have interviewed before, right? So their home country systems are different, and residency interviews tend to be something very different and new to the IMGs. And so I wanted to get your perspective, starting maybe with Chad, on what you have seen that they can improve on, you know, because that interviewing is something that comes with experience, and obviously they are not used to this system. So what do you think overall they have done well, and things that they can improve as part of the entire interviewing, whether it is one-on-one with the faculty, or, you know, meet and greet with the residents, or anything else?
Sure. So thanks, Juan. Great question. And this is something that actually Joe and Al and I have talked about in the past.
Mm-hmm.
So I think a lot of my applicants don't realize, but once somebody actually extends you an interview and says, hey, we'd love to actually chat, see you face to face, the majority of the work has already been done.
Mm-hmm.
So the program's basically telling the applicant, we love the way that you look on paper, your scores are good, and you basically check off all these boxes that make you a desirable candidate. And at this point, it's kind of a litmus test to understand, is this the type of individual that I want to spend 50 to 70 hours a week with for the next three years? Is this the type of person that I want to spend more time with and I'm going to be spending potentially with my family at work? When there's a code at 2:00 in the morning and I'm on call with this individual, will this basically be a dependable and even fun, enjoyable person to spend time with? So a lot of individuals that I've done these mock interviews with, and then even my own mentees that I've worked with, are very, very hard on themselves and almost like flashcards go through hundreds of potential questions. And while it's really important to be as prepared as possible, I think that individuals need to know that, if you are so unbelievably structured and you have an answer in your mind for every single question, it's going to come off as very, very stiff and kind of scripted.
Mm-hmm.
And these interviewers have done, hundreds, thousands of these interviews, and they know what is kind of a spontaneous answer, what's scripted, and everything in between. So I really encourage my applicants, of course, to have a baseline level of professionalism for all of their answers and all of their conduct during these interviews, but to not shy away from letting their personality shine through, and to really allow themselves to, if you answer a question truthfully and you're able to defend it, there's no incorrect answer to any of these. And programs really are not looking for one specific answer. They just want to see, how does this individual work on their feet, whether or not they can be spontaneous and quick with their responses, and does this just seem like a normal human being? Are there any red flags that I maybe didn't pick up on during the paper application review, and does everything kind of match up? So I encourage my applicants to really not shy away from letting the personality shine through.
Okay, thank you. Joe, what has been your experience? What can they improve on in interviewing, the entire interview, start to finish kind of experience?
Yeah, so I pretty much I agree with everything that Chad said, and like I said, talking about the application, something that I really encourage them to do is highlight those aspects that make them unique, and talk about themselves. Not only I'm going to be a hard worker, I'm going to be a good teammate, I'm really smart, I work hard, whatever. You want to talk about yourself kind of outside of the hospital too, and let them know what you're like as a person. So kind of like I mentioned, the hobbies and stuff, I felt like that was something important to talk about as part of the interview as well, not only to put on your application, but as part of the interview as well. And then in one of my interviews, I actually just straight up, the interviewer told me, they were like, yeah, I read your personal statement and I read your application and that was all great. But I didn't really feel like I got to know anything about you as a person. I read about your whatever accomplishments and your passion for radiology or whatever they said. But you didn't really tell me anything like, do you have a brother? Or you have a sister? What do your parents do? And so, when I'm talking to the applicants, and we always start off with like, oh, just tell me about yourself, because
Mm-hmm.
that's usually how a lot of my interviews started. I always tell them, well, mention, I grew up in wherever, and I had a brother, a sister, a dog, my parents did this, we lived with my grandparents, just to give them a sense of like, okay, well, this is the background that they come from. This is, how they grew up, and that's what shaped them to become what they are today. So I think that's just, kind of like Chad said, speaking about their individual characteristics, about them personally as people, more than them as doctors, I think is important to include in the interview.
Okay, interesting. Alan, anything else you want to add?
Yeah, I mean, we did all kind of talk about it, and I think the biggest thing to remember for all applicants is that this really is a personality test. The way I describe it to the applicants I interview is, you want to pass the layover test, meaning, if you're stuck in an airport with someone for a 4-hour layover, and you have two applicants that are identical, when you, at the end of the day, you have to pick the one that you want to be in the airport with for those 4 hours. And that's kind of what they're doing in that interview. They're really trying to figure out, who do I want to spend 50 to 70 hours with, who do I want to be on call with. And the way to really do that is to, you obviously have to highlight your accomplishments and talk about some of your experiences and how that will, how that will affect you as a resident, make you a better resident. But you do need to kind of show your personality and your personal side. And especially with the tell me about yourself, Joe kind of hit the nail on the head there, that, I'll ask them that question first and it'll be a list of accomplishments, a lot of professional things, but then come towards the end, I find out they have a fiance or they have a kid and they never even mentioned that in their tell me about yourself. So it's kind of a balance. That first question is really a good chance to kind of balance both the professional aspect of, maybe like your med school, where you completed your, wherever you're working, what you're doing now, but also highlighting your family and things you like to do outside of medicine, whether it's yoga or watch documentaries or sports that you like, because it gives the interviewer a chance to kind of grab onto something outside of just professionalism and leadership and research. Because maybe, for example, I would prefer talking about, if you're a fan of a sports team and I like that same sport, or a book that you read that I read, and we can kind of connect on that aspect, and it will really, make you stand out when it comes on to, like, ranking people and kind of having that memory of that person. Because, other questions will gear you towards your accomplishments, towards your leadership, towards your strengths and your weaknesses. So when you have an opportunity to talk about something personal, I would say really use it. Then towards the end of the interview, when they do ask questions, what questions you have for me, I think in terms of in the interviews, when you're talking to program directors and attendings, make sure you're asking meaningful questions. Don't ask questions that are just kind of throwaway. This is like your last 5 minutes with the person that's going to kind of be talking about you and hopefully fighting for you come rank time. So you kind of, if this is your job. So if you have something that will really affect the way you're going to rank a program, then go ahead and ask that. If you're very involved in research or leadership, then, and it really is important to you to have a dedicated month each year of your residency, then ask that question if it's not somewhere already on the website, because that'll change how you rank them. But if you're just going to ask a question about, do we have a teaching opportunity, and you don't really, that's not going to change what you do come, rank list, then I think you can find a better question to ask them and kind of, highlight yourself and highlight, the opportunity you have to talk to a attending and program director.
Okay. This was excellent. I think we covered a lot of ground in terms of the changes that they can make in their ERAS CV, personal statement, interviewing. So thank you. This was very, very helpful. I now want to switch gears and talk briefly about the non-traditional specialties. So outside of IM, FM, PEDS, neuro, psych. So Chad, starting with you, I'll have the same two questions for all of you is, what do some of these non-traditional specialties, and by non-traditional, I mean where you tend to see less number of IMGs, what do these specialties look for in terms of the profile, in terms of the experiences? And then the second question is, how can IMGs get those experiences and be competitive for these specialties? So you can pick your own specialty or any other specialty.
Sure. So I'm just going to speak on anesthesia because that's what I feel like I could speak on most in detail. So even for American medical graduates, anesthesia isn't one of the core rotations that you have to do as a medical student. So you have to kind of early within your medical education have some idea in the back of your head that it's something that you're interested in, and then take the initiative yourself to go ahead and pursue some clinical rotations for anesthesia. Traditionally, during surgery rotation, which every single medical student has to do, they get some exposure. They kind of peek over the other side of the drape and say, who's that person over there turning all those knobs and, you know, maintaining the airway. And that sometimes is all that people really, really get. So for anesthesia, at least, just showing initiative and having some clinical experience or some, some rotation within the specialty, I think is a prerequisite, something that you have to do. And that goes with anything. If you're going to dive into a career in a specialty ostensibly for the rest of your life, you should have some understanding of what the day-to-day routine is for that type of resident and then even for that type of attending. If individuals aren't able to secure an anesthesia rotation, there are definitely other, I want to say bordering or even fringe rotations that would be very, very helpful in understanding if this is something you want to pursue. And those would be things like emergency medicine, so anything with acute care, intensive care. So if you spend some time in the ICU, that's something that's always looked upon very favorably for any anesthesia applicant. And then other, even internal medicine rotation. So palm crit individuals who work with ENT, so ear, nose, and throat specialists, so have an understanding of airway anatomy and airway management. But very, very similar to a lot of the other subspecialties, there still is a baseline or a ground step one score that you're expected to kind of hit. And if you don't hit that score, unfortunately, a lot of doors kind of start to close around you. But if you have that baseline score and then show some interest clinically, I think it's a very, very reasonable option. And, I think it's the greatest specialty on earth. I'm a little bit biased. But yeah, so those two things, show interest and make sure that you're doing really, really well on those licensing exams.
Okay, thank you. Joe, let's go to you. And if you want to talk about diagnostic radiology or anything else, what do these specialties look for and how can IMGs prepare for it?
Yeah, so, honestly, I think pretty much everything that Chad said also applies to radiology. And, radiology so far in my experience is it's very different than almost any rotation that you're required to do in medical school, because when you do a medicine rotation, you're getting there at 6 a.m. to round on your 35 patients, and you've got to look at all of their electrolytes and all of their levels and all of their check the EKG from the strip from overnight. And radiology doesn't have any of that. Radiology is it's like kind of transient. You're seeing the patients in a way, but only you're seeing it on the screen for a couple minutes at a time, and then it's gone. So I think, kind of like Chad said, getting that experience and being able to demonstrate to programs that, yes, I understand what it's like. I understand that it's not like the rotations that I've done in medical school, and that it's going to be a much different, day-to-day thing than being a surgeon or being a pediatrician or something like that. I think that's one of the most important things to show these programs, that you understand it and you're still interested, despite sitting, down in the dark room for 10 hours a day or however long. And then of course the scores are important too. I think all three of us are in a little bit more competitive specialties in a way. So the scores are always going to matter, for better or worse. But yeah, I think pretty much everything Chad said, is he kind of nailed it there.
What about research? Have you seen in radiologies, IMGs that match? How important do you think is research?
So I didn't have a ton of research, and none of it was specific to radiology. That being said, I am not at a super research heavy institution. We have it, obviously in some departments more than others, but I think it's something that programs would still like to see. And it's something that is just from an application side of it, just something else you can add to your application and have those publications. And then they see, well, you know, we don't have a ton of residents who do want to do research. So maybe this is someone that we would like to have and they could help us, you know, build it up or something like that, you know.
Okay. Thank you. Thank you.
Mhm.
Alan, let's get your thoughts in terms of what these specialties look for and how should IMGs prepare for it.
Yeah, but before I do, I want to go back to the last question about how to increase the, you know, improve your interview.
Sure.
I think one thing that I always kind of harp on with the people I'm doing mock interviews with is that give examples. You know, if you say I want to be a teacher, I want to teach med students, you know, give an example of how you would do that. Do you want to create a didactic program for the med students during lunch on a weekly basis? You know, let them know that, show them that you're not only, you know, you want to teach and you want to mentor, but that you've taken time to kind of think about what that looks like in an actual residency program. You know, I think we always talk about being a team player, resident wellness, but, you know, show that, you know, mention that you want to be on a wellness committee or you want to, you know, organize lunch for the residents once a month so you guys get a chance to, you know, de-stress and hang out and kind of get to know each other personally, and how that can improve patient care in the future when, you know, everyone kind of is closer with each other. So I think examples are a really big way to elevate your interview, elevate yourself, and really show that you've not only said those buzzwords that a lot of us know about, but have thought about what those buzzwords actually look like in action when you're, you know, ideally at that program next year. But in terms of going into physiatry, physical medicine, rehabilitation, obviously experience is the number one thing for all the non-traditional programs. For physiatry specifically, it's really about volunteering, finding opportunities to volunteer, and it doesn't always mean you have to be at a large academic center or a well-known established place. It really can be, you know, being a physician, a team physician on the sideline of, you know, a local sports team, you know, helping out as a team physician at just any kind of, you know, small tournament. It really is just showing the interest in the field. That's the biggest thing. You know, anything from, I remember I volunteered at Special Olympics Illinois, and we kind of helped fundraise and, you know, put the entire Olympics together. I worked at Access Living as well on a volunteer, you know, young professional board where we put together the Disability Pride Parade, and really just kind of got involved and networked with, you know, different people in the field, you know, social workers and therapists, occupational physical therapists, speech and language pathologists. You know, they were kind of in that same realm of rehab. You know, you can even come and volunteer at an inpatient rehab center, acute inpatient rehab, where a lot of physiatrists are staffed. But it really is just showing that it's not just, you know, this is my backup plan. I want to be an orthopedic surgeon and my numbers didn't, you know, pan out, so I'm going into physiatry. It is, you know, if you show the interest early on and kind of get plugged in in one place, and then you can kind of build from there. I think physiatry definitely, you know, attracts a certain personality. Everyone I've met in terms of residents along my medical school journey, and even now, people are very friendly, open, willing to help. So kind of fitting that mold and realizing that if you know, are interested, there are people willing to help you and kind of, you know, guide you along the way.
Okay. Well, thank you, gentlemen. This was very, very helpful. I appreciate your time. I think this will be very, very useful to other IMGs in coming seasons that can take guidance from you all. So thank you, and I appreciate your time.
Thanks so much.
Thank you, Pawan. Happy to be here.
Yeah, thank you.
Thank you.